GLP-1 receptor agonists, such as Ozempic, have totally transformed management strategies for obesity and diabetes by offering a lot of benefits. We're talking about weight loss and metabolic benefits. But we have some evidence that shows that these drugs can also really affect mental health and your emotional well-being, with side effects that are complex, varied, and sometimes unexpected. Now, if you go to Ozempic's website and look at the side effects page, mental health side effects are not listed on the main website's page. Now, the website highlights digestive issues like nausea, diarrhea, stomach pain, constipation, and vomiting as some of the most common side effects, but it doesn't mention mood changes, depression, anxiety, or any mental health symptoms among its reported side effects. So that's why we're talking, right? The site tells you to speak with a healthcare professional about any side effect that continues or is bothersome while you're taking a medication, but it doesn't specifically address any psychological or psychiatric symptoms that may develop while you're taking the medication. So in order to understand this, it's important to look at how Ozempic actually works and why it affects mental health. Now, Ozempic or semaglutide, it mimics something called the human GLP-1, and it alters insulin, appetite, and brain chemistry. Now, GLP-1 receptors are present in the brain, and they help regulate mood, reward, anxiety, and motivation. So because of these connections, taking Ozempic can actually result in both physical changes and shifts in your emotional and your mental states. So that's why it's important to reveal everything to your physician as far as your mental health is concerned. Now, when you look at the different platforms, users actually talk about a mental shift after starting medications. They talk about crying spells, some new anxiety, new emotional attachment. Some people say they feel flat with diminished pleasure, motivation, and interest in activities they once loved. So when you look at Reddit and you look at all these sites, it's important to understand that you may not experience any of this, but some people have reported some waves of depression that happen days after each injection. And, typically Ozempic is going to be something that is done like once a week, right? So just understand that people are having different experiences with these medications. And it's important to understand that when you're in a relationship, you need to talk about this with your partner because you might change while you're on the medication. Some people report loss of libido and reduced enjoyment and hobbies and things like that. And these are all just, patient reports that you can see online and things like that. Now, there are some recent studies and case reports that have confirmed these experiences, which highlight an increased risk of depression and suicidal ideations, especially for the people who already have like a personal or family history of different mood disorders. So once again, it's important to report any side effects that you're having to your healthcare provider, especially as far as your mental health is concerned. Once again, you see that it's not listed. You don't see mental health side effects listed on the medications, but I just want to stress that the relationship is super complicated. People may have depression that may stem from the underlying health condition of obesity as well. And then you have some studies that don't necessarily agree that the GLP-1 drugs consistently worsen mental health. So there are reviews and studies that are still going on. But the important thing I want you to understand is that if you notice any mental health changes, it's important to talk to your provider about it. The other thing I want to talk about is the different reasons, like the mechanisms, why these symptoms might even occur if they are occurring. So you look at Ozempic, which is going to affect the dopamine and some other neurotransmitter that may govern pleasure and reward and make food less emotionally satisfying and considerably suppression of some feelings of joy. You know, these are some things that you have to consider. Once again, you may not experience any of them, but there's a possibility that, sometimes people even get dehydrated because they don't have that impulse to drink as much, Some people actually self-medicate with food, and then the GLP-1 drugs, they may disrupt this coping strategy of self-medicating with food, and that will still leave the emotional needs unmet or unprocessed. Then you talk about another issue, which is people who are using the GLP-1 medications. They can sometimes have like complex, feelings and things like that are triggered. They might have relief from the shame and discrimination linked to obesity. And then some people talk about having shame for taking the easy way out or feeling disconnected from their social community because they don't feel like going out to eat. They don't feel like going out and grabbing a drink. So it's important to look out for some warning signs that you need to talk to your provider about. Persistent sadness, loss of interest, or just feeling real flat, heightened or unpredictable anxiety, trouble sleeping, concentrating, trouble just feeling motivated. And here's a big one. If you have new or increased thoughts of self-harm, hopelessness, or despair, you got to call somebody. You got to call your provider. Withdrawal from family, friends, or social events. If you see your friends withdrawing, make sure you check on them. You understand? It's important that you stay on top of your mental health while you are taking these medications. Mental health monitoring should be a routine part of treatment for anyone who's prescribed these medications. And we talk about, okay, well, what is it that we can do at home? Just monitor how you're feeling. Write it down, Talk about your mood changes with your provider. Make sure that you are maintaining an adequate caloric and fluid and nutrient intake while you're taking the medications. Look at some support groups, and then make sure that you have built a strong support system with your friends and family so you can talk to them about these type of things. There's always, a consideration that you can change medications, you can change dosages, and just make the necessary changes if these symptoms become severe. I'm Dr. Erica R. Jones, MD. Make sure that you like this video if you got something from it. Share it with someone if you think that it will be useful for them. And subscribe to the channel if you haven't already.